Hey everyone, we'll get started here in a couple minutes. All right guys, we'll give everybody about one more minute to tune in, then we'll get started. All right guys, about to get started here just in a few seconds. Let everyone join in. Give people a little bit extra time. All right guys, we'll go ahead and get started. My name is Dr. Stone. For those who have not met me yet, I am the newest addition to the pediatrician team at Centennial Pediatrics. And the past few months, I've been hosting these Instagram live Q&A sessions just for a way for y'all who have not met me or have not engaged with me around the office to get a sense of how I manage things, and also just to be helpful. I know there's a lot of questions that get asked either to our nurses or to the doctors themselves, and I just want to put information out there that will be helpful to people if everyone's thinking the same question. But sometimes when everyone's thinking the same question, no one really wants to ask it. But this is a time that allows people to write in questions and for me just to read through them and answer everyone's questions that they have. And so we've been doing this now for a few months, and we've had pretty good turnout each time. And so we'll probably continue to do that. And throughout the week, I've just been asking people to message in their questions to our Instagram profile account. And I've taken 9 questions today that we'll go through, and today's topics are centered around summertime, whether that be pediatric medicine in general or just parenting. I actually have our little fun sunscreen and off containers back behind me. We'll talk about that later. And so I'll just draw some questions out of our hat that we have here. We'll go through 9, and then at the end of it, I'll allow people just to write in some questions. If I feel like they're good questions, I'll answer them live. And I believe there's also a function here on the Instagram live chat where you can actually write in a question, or you can just type in the comment in the feed. All right, guys, we'll go ahead and get started. All right, so our first question is, where can I find which vaccines my child needs when traveling out of the country? So I thought this was a good question because a lot of people are starting to travel whenever it comes summertime in terms of vacation. And I've had a lot of my families who ask me, they tell me, hey, we're going to country X, Y, and Z. Is there anything that we need to do beforehand, or any vaccines we need to get, any medications we need to take beforehand? And a good resource that I point families to is called Passport Health. That's passport, one word, and health, the second word. They have some clinics around the DFW area, and I like them a lot because you can go on their website and search by which country you're going to, and they'll, by the recommendations that are out there, provide you which vaccines you need to get beforehand, including for your child. And you can actually get those vaccines at their clinic, because we don't personally vaccinate against typhoid fever or yellow fever, typhoid fever, yellow fever, but you can get those there. And that's a good resource to see if you actually even need those before you go. We do, at the clinic, do our own malaria prophylaxis. So if you're going to a country that has a high prevalence of malaria, that the CDC recommends malaria prophylaxis for your child, we do write those prescriptions. But the vaccines themselves, we do not offer at our clinic, but a good resource to find out which vaccines you need and where to get those is a website or company called Passport Health. And then you can also go on the CDC website as well, but Passport Health is nice because not only can you find the information, you can also get the vaccines at their clinic. All right, next question. How do I keep my child safe around the pool this summer? I thought this was an excellent question, most importantly because the number one leading cause of death for kids age 1 to 4 is accidental drowning. And so this is super, super important for our toddlers that are in the clinic. And so the biggest thing the biggest prevention tool that you can use is always make sure you know where your child is whenever you're around a pool. And so what I usually do, and obviously circumstances are different, but I'll always like to recommend one parent per child. So if you have 2 children, I usually recommend, hey, 2 parents going, or if you only have 1 child, then 1 parent is probably fine. But it becomes difficult to keep track of your kids whenever you're especially at a public pool and you're outnumbered. Now, I know once you have 3 or more kids, it's harder to maintain that rule, but that's a kind of a first step I recommend. And then also getting your child into swim lessons early. So there's swim lessons all throughout the North Dallas area and the DFW area. There are a couple companies out there. One's called Aquatots. I did that with my son about a year and a half ago, and it was pretty good. It's pretty short lessons. It's frequent. They have age groups. They have skill groups. It's all good. My son learned a good bit. If you're someone who likes very organized lessons and lessons that also the parent can get in the pool with the kid, that was good company I found. My son, we're also looking at the Frisco Athletic Center. For those people who are in the Frisco area, they have a abundance of swim lessons that are at a lot of different times throughout the week, and they're usually for a couple weeks. That's what we're probably going to do with our son. There's also some other swim lesson classes out there. I know Prosper ISD has one. You can pretty much find them all throughout the North Dallas area. What's nice about living in this area is there's just a plethora of resources wherever you go. So I highly, highly recommend swim lessons early, because if for some reason you lose track of your kid and they, God forbid, fall in the pool without you knowing, then that is obviously going to save their life. And so last thing I recommend is, let's say you're over at a friend's house or you're over at a neighborhood get together and you don't know where your kid went and you're confused because they're with other kids, they're not upstairs. I always, always, always recommend, please check the pool first, okay? Because, if they are hiding in a closet, they're hiding in the bathroom, whatever. But if for some reason they fell in the pool, that's what's going to get them killed. And so if you ever lose track of your kid when you're at a friend's house and they have a pool, immediately walk out to the pool and make sure they're not around it. And also, if you do have a pool, you can also get these toddler gates, which I also highly recommend. But the first 3 principles are my kind of go-tos. All right, go to the next question. Someone says, the trick is finding swim lessons that don't require you to be in the pool with them. That's a good one. Agreed, especially if it's in the early morning and freezing cold. All right, what does a heat rash look like? How do you treat it? Yeah, I thought this is a good question, obviously, because it's starting to get hotter out there and we have a lot of rashes that come into our clinic. So if you want to get super scientific about it, there are 3 types of heat rashes. They all start with the word miliaria, and then they follow with crystallina, rubera, and then profunda, I'm pretty sure is the 3rd one. The first 2 are the most common in pediatrics, and they usually look like very fine red papules that just erupt, and it's usually on the trunk, the chest and abdomen, on the back of the arms. They can be on the face, and so it's not dangerous. You can just take your kid out of the heat. You can get them cool. You can put on some moisturizer cream. It's pretty simple and straightforward. Obviously, if the heat is causing the rash, then you take them out of the heat. If it's just a heat rash, you don't need to be seen in the clinic. Heat rashes should disappear pretty soon after taking them out of the heat, probably within the first 12 to 24 hours. So if something's persisting and it's worrying to you, by all means, bring your kid in. But they usually look like very red, fine papules that disappear once you get your kid out of the heat. All right, going to the next question. When do soft spots close? Yeah, it's a great question too, because there is a high variability of normal. So the average soft spot, and when I say soft spot, I mean the head, I'm assuming that's what the writer was referring to. That's called the anterior fontanelle. So the anterior fontanelle right here typically closes on average around 15 months of age. Now, like I said, it's there's a variance, it's a bell curve. So the mean is 15 months, but that doesn't mean that your child's soft spot's going to close in 15 months or at the 15-month mark. It actually can close as early as 8 or 9 months and close as late as a couple years. And if it does close early, the only thing you want to obviously keep in mind, and which everyone in our practice will keep in mind, is that their head circumference continues to grow along with the rest of their body, because you don't want the soft spot to close and then their head doesn't, if the head's not growing, then obviously that's a problem. But if it does close, the head's growing and they're developing fine, it's totally normal. And then there is a posterior fontanelle back here, which closes within a couple months. It's a lot less common, obviously, to feel because it closes so early. But the typical time for the anterior fontanelle soft spot is around 15 months. But like I said, there's a high degree of variability. All right, guys, next question. How to prevent infection and scrapes and cuts? Yeah, obviously another good summer question. So your kiddos will be out and about riding their scooters or bikes. They'll fall down, they'll get scrapes. And what's the best way to prevent infection? So first things first, you'll just wash it with soap and water. And then after that, I do typically recommend, if you do see blood, that if it's bleeding or if the skin has been scraped off, putting a little bit of over-the-counter topical antibiotics on that just to prevent infection. You can just do it twice a day for 2 or 3 days. The typical one I recommend just over the counter is called bacitracin. There is also, Neosporin, all those things. Neosporin is fine. It just incurs a little bit of increased risk of what we call local dermatitis. So some kids will break out in a little bit of a rash with that Neosporin. The bacitracin has less of that rash. Either way is fine. The rash is not super harmful anyways, but if you want to avoid any complications, bacitracin is a great choice. And then obviously if you have a bunch and you're looking more infected, then you can always bring your kid in and we can make a decision whether we should do topical antibiotics or oral antibiotics. All right, guys. How to treat bug bites? When should I see the doctor? Yep, another great summer question, because the mosquitoes will start to be out now that it is going to be a little bit warmer during the day and cooler at night, and a lot of the grass is growing and the flowers are blooming. And so typically bug bites, you don't need to do a lot for the mosquitoes, ant bites. They will look pretty almost indurated and red and firm now and circular, and that's fine. At that point, I would have a low suspicion for infection at that point. It's most likely just a local inflammation process just from the reaction of the bite itself. And the thing that you want to always try to do with bug bites is to prevent your child from itching it, because what will happen is we all have bacteria that live all over our skin, and the bacteria like to take advantage of environments. And so if your kid gets an ant bite or a bug bite and they're itching, and they scrape the top off, well, that bacteria can get inside that bite and create something called cellulitis. And so that's just a local infection of the skin. And what that will look like is, streaking redness away from the bite. And then obviously, most kids don't have fever with cellulitis, but if you're having fever and you're having that streaky redness, that's definitely a reason to call us. But if you're having even just the streaky redness from the bite, and especially if your kid's been itching it, that's a reason to call us, because that could be a secondary sign of infection. But to prevent all that, what you can do is you can either just get some topical Benadryl cream or some topical hydrocortisone cream, 1% cream over the counter. And those will both prevent itching. And then obviously you can also do some oral Benadryl if you need to, just if your kid is really itching. All right, next question. Actually, let me get a sip of water real quick. So it's getting a little dry. All right. What are signs of swimmer's ear? How can you prevent it? And how do you treat it? When can you return to swimming? Yeah, obviously another summer question. So swimmer's ear, there are differences in when people use the colloquial term ear infection. So when it comes to your 1, 2, 3-year-olds and you're in the wintertime, when someone talks about an ear infection, they're typically talking about something called otitis media. So otitis media is an infection of the middle part of your ear, whereas swimmer's ear is usually related to older kids because they've been in environments in the pools and water parks and all those things, and water can get in the external canal, which is on this side of your eardrum towards like the outside of your body, and that can breed bacteria, and that's called otitis externa. And so typically what will happen, or the signs and symptoms of otitis externa, aka swimmer's ear, is a super painful ear. And the big clinical physical exam finding is whenever you move the tragus, which is this part of your ear, if kids are having pain with that, that's typically a sign of otitis externa, not otitis media. And so also whenever we look inside your kid's ear, you'll see a bunch of redness, or we call it erythema, and then exudate, which is just a bunch of pus essentially. And that's from the bacteria that's overgrowing the ear canal. And so to prevent it, it is keeping the ear as quote unquote sterile as possible. And so that's just, you can either wear earplugs whenever you're going swimming. You can use a half and half combination of rubbing alcohol and acetic acid after you swim. And that's just to either evaporate any water or keep the environment more acidic. And then if that doesn't work and you start to have infection of the ear canal, then you can't really use the over-the-counter swimmer's ear drops to treat it. It's not really going to treat it. What you really need at that point is topical antibiotics. And so that is something that you would need to see us for. And so you would come see us, we'd give you some ear drops, you'd treat it for about 7 days or so. And so after those 7 days, you can return to swimming. Now, if you're a competitive swimmer and you just have to be in a meet in 2 to 3 days, if you're treating it and you're wearing earplugs, having symptoms, then yeah, you can go and compete in your meet. But if you're not, I'd probably just recommend finishing off the course of antibiotic ear drops and then going back to swimming after that. All right, guys, we only have one more. This was kind of a shorter session. So after this one, I'll ask if anybody wants to write in any questions, and I'll go ahead and field those. Our last planned question is melatonin safe to give on occasion? Absolutely. So melatonin is just a chemical that your brain uses to regulate its circadian rhythms and help you sleep. And so you can get over-the-counter melatonin. You can get Zarbee's melatonin. There's other types of all natural type of melatonin that you can find in the children's section at pharmacies. And so those are definitely safe. Now, there's been no long-term data on it. There's really no recommendation on how much people should get. Typically, I recommend, 1 or 2 milligrams for your preschoolers, 2 to 3 for your school-age kids, 5 for your high schoolers. You can't really become quote-unquote dependent on it because your brain is already using it anyways. And so, does it help? Probably. Is it going to fix all your sleep issues? Absolutely not. So, those are other things you need to dive into. But yeah, absolutely, as needed melatonin is definitely safe. Okay, guys, that was all the planned questions we had for tonight. If anybody wants to write in some questions in the chat, I'd be happy to field those if those are good questions. I'll go ahead and look as well in our question. Nope, we don't have any writing questions yet. So I'll give everyone 2 or 3 minutes to write in questions and see if there's something we can talk about. I know this was a summer talk, but if you have any questions outside of the summer topics, I'd be happy to answer those too. Give everybody about another minute. I don't see any. Oh, here we go. I have heard taking melatonin long term can cause your brain to stop producing it. Have you heard that? I have not heard that. I would seriously doubt if there's any real studies on that. And the reason I would doubt that is because I don't think you could get anyone to measure melatonin in the brain in normal individuals long term to conduct that trial. So if someone is saying that, I would put a lot of money that is conjecture. And I would also probably doubt it to begin with, just because, the amount that you're taking is certainly far less than your brain is making. So I would have very little hesitation in taking melatonin every day. Oh. All right, guys, keep them coming. I'll give everybody another minute or so to write in any questions they want answered. Sorry I joined late. Did you talk about baby safe sunblock? That is interesting because I remember typing up that question and for some reason, I wonder if it got lost. Thank you for reminding me. I did have that question written, but I don't know what happened to it. So thank you for reminding me. So, and I see someone else wrote in, but let me talk about the baby safe sunblock. So the AAP recommends 6 months and above can have sunblock. Now, if you have absolutely no other option and you're stranded in the middle of the desert with your 3-month-old and the sun is beating down on you and you have SPF 15 with you, by all means, put SPF 15 on your baby in localized spots to protect them. Or if there's just absolutely no other option, a little bit SPF 15 in certain areas that are going to be exposed is totally fine. Now, don't do that on a daily basis. Don't do that regularly under the age of 6 months because it is recommended for 6 months and above. But if there's absolutely no other option, the AAP does recommend using a little bit SPF 15 if you have to. Now, above that, age 6 months and above is definitely safe. So I recommend SPF 30. You can do 15 to 30 is fine. Obviously, you're going to get a little bit more caked if you use 30. But and the reason why I usually recommend 30 is because of most people, including myself, are not the most reliable in terms of reapplying and being on top of it as much as you need to. And so that's why I go for the higher number of 30. And then the bug spray, DEET. So you can use DEET and just make sure it's 10 to 30%, or excuse me, 10% to 30% DEET. I'll have to look up the age again. I'm pretty sure it's 2 months, but I'd have to double check that and get back to y'all. I saw another question. What is the normal age that kids need deodorant? I have heard body odor too young should be checked out. Weird question, I know. So how I'll phrase that is, or how I'll phrase my answer is, body odor typically comes on with puberty. So, and the reason that is because your body is making more hormones, it's increasing sweat glands, it's increasing sweat. And so typically that happens whenever you're going through puberty. And so puberty should not happen before the age of 9 in boys if you're going by the textbook, and 8 in girls. Now, but puberty is also not defined by how much body odor you're making. It's defined by something called Tanner staging, which doesn't really take body odor into consideration. So can you have body odor and not be going through puberty? Sure. Would that be a cause for concern for me? Probably not. Now, if you had body odor and you're going through puberty before you should, absolutely, I would look into that. But if it's just body odor, I probably wouldn't be too concerned unless you were showing other signs of puberty. But it would be 9 in boys and 8 in girls for puberty. Too early. Okay. I don't see any others. I'll give people another minute or two to write in any more questions. Back to the sunblock question. Is there a particular sunblock brand you recommend, or ones to avoid, ingredients to avoid? What about mineral sunblock? Not really. I grew up with Coppertone. I think most people probably did. So that's the brands, we usually go to. There hasn't been a lot of robust data to show, your sunblocks on the counter, are infants or kids absorbing those hard minerals. Doesn't seem to appear that way, at least what we're finding right now. There's been concern for, aluminum and all that stuff in the past. but no one's really proven that you're systemically absorbing them or if it's causing any long-term damage. So right now I'd say, just go with your big brands because typically those are the most used and most data that they have. So Coppertone is what we use around our house, but really any brand that you find on the shelf, as long as it's reputable, is probably okay. I haven't found ones that I have avoided yet, unless they're trying to sell me that they are blocking sun in some strange way that I haven't heard about. I think I forgot to mention at the top of this, I usually do, but anything you're hearing me say tonight, please run by your pediatrician. Don't take this as actual medical advice. This is just a fun way for us to get to know each other. However, if you have an actual question or concern about your child, please bring it up with your child's doctor. All right, guys, we'll give us another minute or so. Any more writing questions? And let me know if y'all are enjoying these sessions. I'm doing this just as a way for everyone to get to know each other and for y'all to get to know me and me to get to know y'all. I hope it's helpful as well. I'll keep doing them on a monthly basis as long as people are enjoying them and are getting something out of them. But I also don't want to be wasting people's time. Oh, also, personal life update for those who have gotten to know me. Some people probably know this. My patients probably do if I haven't said it. My wife and I are expecting our third kiddo, and we found out the gender today. I'm actually not going to reveal the gender tonight on the Instagram session because I'm going to surprise the office with a gender reveal tomorrow with a dessert. So I'll post the color of the dessert on our Instagram tomorrow to let people find out what we're having. But we did find that out today, so that was exciting. All right, guys, we'll give everybody about 30 more seconds. Any last writing questions? Thank you. All right, guys, going once. Congratulations, we have 4 kids. It's lots of fun. Thank you very much. Going twice. Last call for questions. Like I said, I'll be hosting them monthly for now. So if you think of a question later, please just feel to Instagram message us and I can answer it next time. All right, guys, looks like no one has any last questions, so we'll go ahead and cut it off. Thanks again for everyone joining in. I hope this was helpful again, and it was great talking with all y'all. And like I said, I'll post the picture of the gender tomorrow, but you don't hear from me until next time. We'll see you next month, and thanks again for tuning in. Bye, guys.